about that? Terry?
Well, as a teacher, I know there's no research to support that. So I know sometimes people have that fear, but there's no evidence that would say that that's actually happening. And when we look at countries where the comprehensive education is happening, where families and communities are talking about sexuality, as people grow up, that they have lower teen pregnancy rates and STD rates, and they have sex at later ages than our teens do, and they have fewer partners than our teens do. So it's not a logical argument. I understand it may be fear-based, but there's no substance to prove that that would actually happen. And I'm a big believer that information is power, and that people given accurate information are more likely to make decisions in their best interest rather than less likely to make decisions in their best interest. Can I just say one more thing around the title? When I was reading that, the morality, the moral issues versus the health issue, just seems like such a strange setup, because I absolutely think of this as a moral issue. And to me, it's unethical and immoral to withhold information from young people that can save their life. And so no matter anybody, actually not just adolescents, but anyone, that I think that it absolutely is a moral issue that we as adults need to step up and help young people navigate through sexual decision making. And the best way to do that is to be forthcoming and honest and accurate in our information.
Thank you very much. Marissa, how does that make you feel? I mean, you're how old?
I'm 16.
16. So when somebody is basically saying to you, if we give you information, that means you're going to go out and behave very carelessly, how does that make you feel?
Well, first of all, the reality of it is that I think there's a new statistic out that says the average age of somebody having sex for the first time is 17.3 years old. And we can't sugarcoat that. I mean, the truth is that some teens are having sex, and we just need to get the information out there so that they can make accurate decisions and safe decisions and protect themselves.
Thank you. So you both referred a little bit to research and studies. Has there been any information that has come out in the studies that you've read as to the success or the impact of abstinence-only education on youth?
There have been some studies that have come out. I know that one of our biggest proponents in Congress is Congressman Waxman out of California, who's done a range of studies on this issue, and he came out with a report. I don't know the exact year. It's been with him the last couple of years, really looking at abstinence only until marriage programs, because the federal government puts so much money into funding these programs.
How much money? Do you have any ballpark?
My ballpark would be $120 million. Don't quote me on that, but I know it's over. I know Washington State, gets upwards of $2 million in our state for abstinence only until marriage program funding. So what Congressman Waxman wanted to do was really, let's look at these programs we're funding. If we're going to increase the money that's going to these community-based organizations, are they really being effective? And both his report came out and said there is really no evidence base to show that these programs are delaying sex. They are not really doing anything to protect teens from STDs and unintended pregnancies. There's also a report that recently came out from the Government Accountability Office, the GAO, looking again at these programs and looking at how they're not effective, they're not working, and a lot of the information is inaccurate.
What are the indicators that they're not effective?
The rates aren't going down. There's ideas. A lot of these programs use virginity pledges, and so there have been some surveys out of youth who've taken these virginity pledges, saying that they.
Marissa, you're nodding and smiling. What do you know about virginity pledges?
I had a program. It was called Share, and they came in and they gave us these little keychains where we could sign them, saying that we were going to stay abstinent until marriage. And I just remember looking around the classroom and seeing my friends kind of looking at those and looking around at other people saying, like, do I really want to, because they weren't sure whether they were going to wait or not, or it didn't really hit home with everybody, I guess.
Did you feel like that was an effective tool for you and your peers in terms of convincing folks not to engage in sexual activity? Or?
I think maybe for a couple of days it might have kept it in their minds, but I saw a lot of those in the trash can, and people just, they don't respond to that.
Didn't seem to resonate with your peers.
I'm
sorry, I cut you off. She was like, oh yeah, I've seen those.
I know. Well, yeah, and I've talked to a lot of students who, when I mention virginity pledges, say, oh, I have friends who had rings and they have cards, and there's a program in Vancouver that has an ATM card that's an abstinence till marriage card, and you get 10% off at your local businesses if you sign it.
Wow.
But the reality is that the New York Times did an article that said that virginity pledges maybe delayed the onset of sex for the teens who signed them maybe 6 months. But nothing compared to what the idea is you sign it and you reserve yourself till marriage.
Is that statistically significant, 6 months, in terms of the onset
Not
of sexual activity?
really, because and Terry, you might have more information.
Well, I was just going to say, it's great for teens to be able to delay their sexual onset later. However, what they found was that those teens that, when they became sexually active, were much less likely to protect themselves. Okay. And there's also part of the program, if you take any kind of shame or judgment around it, people are more likely to not, if they do decide to change their mind or break their promise, that some of that guilt and shame can prevent people from going in and getting medical care, because they don't want anybody to know that they, changed their minds. So
that's an interesting, I'm sure that the people who invented virginity pledges are not hating kids and not wanting them to go out and get sick. So that's an interesting consequence then, that, maybe sexuality or sexual onset has been delayed, but that the end result is people are not using protection and then perhaps getting unintended pregnancies or
I'm sure
STIs
it was
and
well.
STDs.
I'm sure it was well intended. But one of the things I found really interesting, I teach at Highline Community College and Pierce College in Puyallup. I teach psychology of human sexuality classes. So I've got about 80 students a quarter that are there right out of high school, and some of them are in Running Start, so that they're teens themselves. And we did this activity where we looked at what the definition of abstinence was, and we had a list of sexual behaviors and asked how many people could engage in this behavior and still be considered abstinent. So we talked about things like oral sex. Half of my students felt that you could have oral sex and still be considered abstinent. So I think we use the word a lot, and people may think that everyone has the same definition. There was wide variables about what people consider to be what you could do and still be a virgin, what was considered sex.
Tell me some of those stories. What can you do and still be a virgin, according to this exercise?
Yeah, well, we actually went beyond our class in that they got on their cell phones and asked their friends and family members. So we actually got pretty good sampling just in class. But some people felt that you could have anal sex and still be a virgin. Much of it was, some of it you could do anything other than penis-vaginal sex.
So I'm not an expert on sexual health. I know enough to protect my body, but am I wrong in saying that actually that form of sex, anal sex, can be more risky?
Around STD transmission, yeah, absolutely.
Okay.
So some of it is, you might consider it sort of loopholes about how people might continue to be sexual, but have a label that might be more acceptable to their peers. And the other piece I'd like to include in this is that if we're talking about abstinence until marriage, we're leaving out a whole segment of the population that either don't plan to get married or are unable to legally get married in our state. So, so we're not really addressing the needs of all of our students.
Okay, thank you very much. What age group did you say that you were getting on the cell phones with?
It's college-age students that are taking my class. Actually, what that means, I have people in their 20s, 30s, 40s that are taking it, but primarily right out of high school.
Okay.
And then they surveyed their parents and their whoever they could get on their speed dial. So one of the best things about sex education, comprehensive sex ed, that can happen is that people can grow more comfortable in communicating about that. And it's one of my joys when I see students who are talking to their parents and their family members and their sisters and brothers and their legislators and their physicians in a way that is really powerful and that they feel comfortable about their sexuality. That's such a healthier place to be.
Marissa, I'm really curious, again, because ultimately this issue of whether or not to receive sex ed at all, whether it's abstinence only, comprehensive, so on and so forth, this is about you and your peers. So I'm really curious, when Terry was talking about what is considered abstinence or what is considered virginity, have you heard conversations like that among your peers?